wife and
You want to call her?
no, my son's working, and I thought, well, you know, they both have interest, but yeah, I wouldn't.
Sure.
I just thought I'd share it with them and my daughter-in-law. There's just my family members that we moved down here about a year ago,
I see.
and so I just thought if there's anything that we could pass
So-
on to them.
But you have history of kidney cancer, right?
Well,
Long time ago.
a long time ago, but
Yes.
they determined it was in the lining because my daughter had gone to NIH for she has oropharyngeal digital and she has a kidney. She had to have a kidney transplant. So they said that I guess they was looking at parents and they said you got to. So I went back and UMS took out and they called it grade 2, I think. But
Yes.
they said that and they looked at it after they took it out of the lining as a tumor. That's what they called it. They didn't see any ongoing problems, but you know we talked about maybe there was cysts when we were out there, and I don't know, they took a whole bunch of different things, and of course I was on a clear diet and then on a renal diet, so I've been through all that.
Yes. So, cause my current concern is when we saw you in the hospital, they were cysts that seem to be complicated or complex, or could be a mass on both kidneys, and that's why we called the urology to come see you. And then they said, let's just put in the Foley catheter right now and let the urine drain properly, and then they want to do an MRI of you to see if this is a cancer or not, to further evaluate, or if it's just some complex cyst that we just may need to monitor and not do anything about it as long as you're continuing to peeing okay and your kidney function continuing to improve, and it's been still improving. Question is, do you still have a Foley catheter or no?
Yeah, I was trying to get rid of it, but
So when do you go to see the urologist now? Because they are the one who will take it out, and they are the one who will do the MRI to see if those masses are cancers or not.
I think that they were getting an appointment set up, and of course this was the first one that got set up.
Yes.
So I don't know.
But I think
don't have
Arkansas urology is who saw you, and they are the one I think you need to follow up.
Okay, I can do that, and yeah, I don't know. Would that be with St. Vincent's or?
I can write my recommendations up here, and the nursing home will take care of this.
Okay.
I think that's more important, because as long as the urine is being drained properly, your kidney function will continue to improve, because you ended up getting kidney problems because your urine was not coming out the way it should have been, and that there was concern of an infection, and an infection can also cause your kidneys to be hurt, but it's been improving. Now I went back to old records as well about a year ago, and seemed like you do have chronic kidney disease to begin with. You have stage 3 chronic kidney disease, and your creatinine, the molecule that is 3.7 now, for you it's been running around 1.4 to 1.6 all last year. They've checked it 2-3 times, and that's what it was running like throughout the year. I've checked it. It was I went through your records, and that's what I found, that multiple times it was checked. And I think you have chronic kidney disease, and that's where you typically run 1.4 to 1.6. And then you got hurt on top of that, and you went all the way to 7. But now you've been coming down, and you've come down to 3.7 most recently, just like last week.
Well, you know, the thing that initiated a lot of this was not getting my heel wound healed.
Yes.
And I guess that's where they looked at the creatinine level, but you know, they think it's doing better as far as healing. That's what they're saying anyway. And of course, that I've had that back on there since about middle of January, I guess, because I was in the end of December to see trying to get something done. So
Okay. Well, I'm gonna look. You're still pretty. You're very swollen, huh?
yeah, real swollen, and they were talking about doing something. Maybe the doctor, Ali or somebody.
Yeah, I want to give you medicine to help with this.
Maybe you were the one. I don't know.
Yeah, but it may not be the best thing for you right now, because your kidneys are already recovering. but this looks too bad. So, you think it's getting worse, or is it getting stable, or is it getting
I
better?
think it's pretty stable. I mean, I don't think it's any
I
worse.
think we just not treat it right now and let your kidney function improve some more, and we follow up with you in 2 weeks. And once the kidney function is slightly more better, maybe we can give you medicine for it then.
Okay. Yeah, I thought that was kind of last we
Yes,
talked about.
and since this blood work is only from, I think, the 27th, right? This is from 28th, just 2 days ago, yes.
Yeah.
So I don't think we need to do any blood work on you today. This is exactly where you were when you left the hospital. So I think you should be okay staying here. I don't want to stick you again today,
Okay.
but let you heal up and let you see the urologist first, because they are the one who needs to fix the catheter and work on those masses on the kidneys to tell us what the deal is, and then we see after you have seen them,
Okay.
and then we decide what we need to do.
Okay, that's kind of what I was wondering, because I know that the therapists seem to think that I'm moving good enough that I probably wouldn't need it, but that doesn't mean that I don't have other problems.
No, your kidney function is still pretty abnormal. I mean, your kidney function is not more than 15 to 17%, so it's still pretty weak, but it's got better. It is exactly the same how it was when you left the hospital or the rehab. It hasn't got any better since then, but I still think you need to get that urology appointment is the most important, because if you're still retaining urine, that's what's causing you to have kidney problems now, on top of the infection that you had in the past, which is
I
already
noticed
getting-
that even with a more of a regular diet, that of course I've been on that for a while now. Didn't seem to have any impact. I haven't seen any blood in the urine. I mean, of course they're looking at it too. I don't know if they see anything else that I don't see. But the lab, they did take a sample the other day, and I guess they did do something to, because I had somewhat of a burning thing coming out of the, when I'm,
when you pee. Yeah, the problem is anytime you have a Foley catheter, it's very easy to get infection. I can give you a antibiotic to take.
Yeah, I didn't know if they were looking
So
for that.
this is what you need to show them.
Okay. I'll see. Yeah, because I thought maybe they really had been working on it, but I haven't seen anything, so they may
So
not.
when you go to rehab, this is what, when you go back today, you show them this, that this is who you need to see, and they will take care of it. But if you're burning, I can give you a antibiotic course to take, so your kidney function can get better. I mean, if there's an infection, it can get better.
Yeah, that'd be fine. I just didn't know what they'd already, if when they took the sample the other day, if they did any prescription. I don't know.
Let me see, because I did not see any urine culture in it, but I can see if there's any urine culture results.
Okay. Well, they took some, and I don't know where I don't know if I ever saw any results, so you may not see any there. I just didn't want to get into something where.
Okay. No,
And I'm sure that, the pharmacy would see it too, but if there's something duplicated, but I don't know.
Okay. So since this blood work is just from like Monday 2 days ago, I don't want any more blood work.
Okay.
I think you go and you try to get a hold of them and you see them, and then I will see you back in 2 weeks.
Okay, 2 weeks. All right.
And they will give you an appointment card before you head out.
Okay.
Okay?
I think that's all right.
You take care, sir. Any questions you have for me?